Here's why it's important to assess for autoimmunity before you've gotten to the point of a diagnosis, and how Western medicine treats autoimmune diseases and why it's not all that it is. The truth is, you may already have some form of subclinical autoimmunity, but the medical system, waits until there's enough tissue destruction or certain antibody levels across a certain lab threshold before giving it a name. So autoimmune diseases, they don't flip on overnight like a light switch. It's a process, often years in the making, and it follows a predictable sequence in the body. First, you get barrier breakdown, most often in the gut. Then the immune system gets exposed to things it shouldn't, food particles, toxins, infections, and it stays activated. Over time, you lose something called oral tolerance, meaning your immune system stops recognizing your own tissues as safe. And that's when chronic inflammation starts, tissues get damaged, and antibodies are formed. But by the time your labs look abnormal, the process is already advanced. The good news is we can measure the early stages. We can look at things like Zonulin, secretory IgA, CRP, lymphocyte reactivity, and even low-level antibodies before they meet the diagnostic thresholds of Western medicine. And even when people get a diagnosis, they're often just handed immunosuppressants. But let's think about that. If your immune system is reacting to something, a pathogen, a toxin, a gut issue, and we just shut it down with a drug, have we really fixed the problem? That's not how I work. I ask, what's the trigger? What's driving the immune activation? Mold, SIBO, leaky gut, Epstein-Barr, metals, dysbiosis. These are all things I think about. And when we find and remove the source of inflammation, rebuild gut integrity, and help the immune system regulate instead of overreact, I've seen people go into remission, not just be given immunosuppressive drugs to manage their symptoms. So if you've been stuck in limbo or are handed a diagnosis with zero explanation, message me the word immune and I'll share how we work at the root level, not just the label.